It's your girl T again. So, I've been doing some really deep thinking about some future elective surgeries. I know a lot of people frown on plastic surgery, but if it's something that you really want to do, I wouldn't deter anybody from doing it. It's a decision that you have to make. Just make sure you do the research. Um, right now, I am currently looking into doctors. I actually decided on one. Yes, I decided to go to DR to get the surgery done because not only is it cheaper, but the results are spectacular. Um, there are limits to what American plastic surgeons can do. Some of them may have very good results, but the pricing is very expensive. So, um, there's a lot of doctors out there like Yealy and Duran and Cabral. Um, but I decided to go elsewhere because those doctors are so booked up and busy. I'm not saying that they're horrible doctors or they're bad doctors, but there's more it's more likely to make mistakes when you have so many patients that you have to, keep up with. So I looked into the doctor that I actually got the WhatsApp application on my phone, and I've been talking to Dr. Walkiris Robles. Um, Her track record is very good. She has years of experience. She's board certified. Um, I'm just in the preliminary phases right now. I'm getting ready to start saving. First and foremost, you want to send off your deposit money to set your date for surgery. That could be anywhere between $200 to $350, depending on the doctor. Um, but they're going to ask you for pictures, your health history, any previous major surgeries you've had, um, things you have to keep up with, your hemo levels. They have to be above, most of them it's 12.7, I think. Um, but it'd be best to set a goal of anywhere above 13, depending on how many surgeries you want. If you want just one procedure, um, I just recommend that you be at least 13, because a lot of people are going over there and having surgery and their iron levels are dropping, and then they're having complications, and usually it's either because of that or, God forbid, like a pulmonary embolism or something like that. Make sure that your circulation is good. Get your EKGs done. See a pulmonologist. Get blood work done. Just make sure that you're in, your PCP gives you a clean bill of health before you decide to make any decisions. And, you go over there or even here in America and you get into, trouble. Some people, they have second thoughts, and by instinct I say just follow your gut. If you make a deposit, you're going to lose that deposit because the deposits are not refundable. But you know follow your gut instinct. If you feel that it's something that you can't live through, and I don't mean literally, but you really feel deeply that it's not something that you think you can go through with, then by all means just give up the idea, and try to work really hard with dealing with work with what you got. Me, I'm 29 years old. I've made up my mind. I know I want to do this, so it's something that I plan on. So I mean, it's just a matter of getting your ducks in a row, making sure that you're healthy, making sure that you save. um Another thing that I've noticed is there's a lot of women that are purchasing like too many items to go over there. you can only bring but so much stuff. There's some stuff that is a necessity that you should buy, like a boppy pillow, or, you know, maybe gloves, baby wipes, because you can't really take a shower after surgery. But just watch out for those lists. You know, you don't have to get everything you see, because some stuff you can go to a local market over there and purchase. It is good to go over there with some items, but don't overpack. You don't need too much stuff. You know, some people, they pack too much stuff. So I'm looking into that. Things you have to look for, like you have to look for get your passport. I'd pre-purchase your airline tickets, because they are cheaper when you purchase them ahead of time. When I go, I do plan on bringing my mother with me. She'll be there. It'll be like a little 10-day vacation for her. Can't say the same thing for me, but I'm planning for hopefully April of 2017. I'm doing this video now just for insight. The fact that a lot of women are doing this now. I don't want to be a statistic to say that I'm trying to have a certain look or anything like that. I'm not doing it for anybody else. I'm doing it for myself. Just to be a better me. I'm not doing it just for appearance completely. I mean, I'm happy with the way I am. I've been this way since I've had my kids. I had my kids starting at 22. I'm 29 now. It's been almost 10 years. I mean, they're 5 and 6 now. They'll be 7 and 8 in October and November. So, you know, it's not a necessity. I don't have to do it, but I choose to because I want to. Yeah, so I'll continue to post on my journey, my progress, where I'm at. I'm going to make up a list of my own of the things that I think that someone would really need for something like that. Just my opinion, honestly, because at the end of the day, you know, you spend so much money on these products and things that you go over there and you don't even use, and you could use that money for, you know, a faja, or, you know, extra massages, or, you know, whatever the case may be, if you get what I'm saying. I'm actually at work right now. I'm a CNA. See my scrubs? Look at my belly. But yeah, so I mean, it is what it is. You know, people make their decisions, they make their choices however they feel. At the end of the day, that's what they decide. um I'm all for this decision. I'm excited. I actually look forward to it, because honestly, right now we're in what, June? It's June 7th or 8th or something like that. I don't know. But yeah, it's like that's what it is at the end of the day. Um, I'm not trying to make a long video. I'm just trying to show my face. You know, let y'all know what's up with T. I'm gonna start vlogging and posting more, because at the end of the day, I am trying to do this channel, keep up with it. You know, I fall off because I have such a busy schedule. I have so much going on in my life. But, you know, a lot of people can relate. I'm a real person, and I'm just letting you guys know what's up. Just from me to you. I'm not rich. I can't afford it. A nigga broke, let me tell you, okay? I don't know where the money coming from. But at the end of the day, you just got to work hard and, you know, make those pesos. So, see you on the flip side. Let you know what goes on. Deuces.